Lung cancer is a group of cancers that begin in the lungs. In the US, it is the second most common type of cancer for both men and women, and it's the leading cause of cancer death for both genders. There are two main types of lung cancer: non-small cell lung cancer and small cell lung cancer. Non-small cell lung cancer is the most common type of lung cancer, making up 85 to 90% of diagnoses. Its cells are defined by their larger and more irregular shape and tends to be less aggressive than SCLC. NSCLC is further divided into three subtypes: adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Adenocarcinoma is the most common subtype of NSCLC and makes up 40% of all lung cancer diagnoses. Adenocarcinoma of the lung begins in the glandular cells, which are cells in the glands of organs, located on the outer part of the lung. This type of lung cancer is typically caught early since it grows more slowly. It is the most common type of lung cancer in people who have never smoked. It is also more common in younger people than other types of lung cancer. Squamous cell carcinoma, also called epidermoid carcinoma, is the second most common subtype of NSCLC and makes up 25 to 30% of all lung cancer diagnoses. Squamous cell carcinoma of the lungs starts in the squamous cells, which are flat cells that line the inside of the airways in the lungs. Squamous cell carcinoma is often linked to a history of smoking. Large cell carcinoma is the least common subtype of NSCLC, making up 10 to 15% of lung cancer diagnoses. This form of lung cancer causes large, abnormal-looking cells to develop in your lungs. Large cell carcinoma is undifferentiated, meaning it can be located anywhere in the lung. It develops more quickly than the other subtypes, which makes it more challenging to treat. Small cell lung cancer is a less common type of lung cancer, making up about 10 to 15% of diagnoses. Its cells are defined by their smaller, more ovoid shape, and it tends to be more aggressive and spreads faster than NSCLC. Lung cancer affects men and women pretty equally, with it being a bit more common in men. Lung cancer also mainly occurs in older people, with the average age when diagnosed being around 70. Finally, black men are more likely to develop lung cancer than white men, but the rate is lower for black women compared to white women. Smoking tobacco is the most common cause of lung cancer. According to the American Cancer Society, about 85% of lung cancer deaths in 2025 are expected to be caused by smoking. Secondhand smoking is also a major cause of lung cancer and is the third most common cause of lung cancer according to the American Cancer Society. Another major cause of lung cancer is radon exposure. Radon is a naturally occurring, colorless, odorless radioactive gas that can concentrate indoors. According to the EPA, radon exposure is the second leading cause of cancer death in the US and is the leading cause for non-smokers. Other causes of lung cancer include previous radiation therapy in the area, air pollution in cities, personal or family history, and exposure to asbestos, radioactive ores, diesel exhaust, or other carcinogens. Currently, there is no way to completely prevent lung cancer, but there are ways to lower the risk of getting it. These include quitting and/or avoiding smoking, getting your home tested for radon and taking necessary steps to reduce it if levels are high, and following health and safety measures at work to minimize exposure to any carcinogenic substances, especially if your work requires you to be around them. Unfortunately, most lung cancers don't show symptoms until later stages, but some early symptoms of lung cancer can include a persistent cough that worsens, coughing up blood, pain in the chest, back, or shoulders that worsens during coughing, laughing, or deep breathing, shortness of breath or wheezing, hoarseness, tiredness or weakness, loss of appetite, frequent lung infections, and unexplained weight loss. If the cancer is not caught early on, it may develop into an advanced stage. If that happens, you can experience symptoms such as bone pain or fractures, swelling of the face, arm, or neck, headaches, dizziness, weakness or numbness in the limbs, jaundice, lumps in the neck or collarbone region, and blood clots. If you are experiencing any of the previously mentioned symptoms, don't immediately conclude it to be lung cancer, but you should get it checked with a doctor. The first step in diagnosing lung cancer is through the use of imaging tools. This can include computed tomography scans, magnetic resonance imaging scans, and positron emission tomography scans. After the initial scans, if the doctor suspects that you may have lung cancer, they will order further testing, which usually involve a biopsy, which are used to get a sample of the suspected tissue for further testing. The most common types of treatment for lung cancer are surgery, chemotherapy, radiation therapy, targeted therapy, or a combination of these treatments. People with non-small cell lung cancer usually opt for surgery, chemotherapy, radiation therapy, or targeted therapy. People with small cell lung cancer are usually treated with radiation therapy and chemotherapy. Lung cancer and cancer as a whole is a complicated subject, and there's still a lot we don't understand. Over the past decades, scientists have made many advances in early detection methods, treatments, and understanding the overall causes of cancer. Hopefully, these advances will in the future pave the way for a cure or even an elimination of the root cause.